Welcome one and all to this feature presentation. In today's topic, we are going to go through the importance of testing and statistics in the control and impact of the infection caused by the coronavirus, also known as COVID-19. We will not only discuss about the COVID-19 coronavirus, but we will also touch on the reasons and importance of the isolation and protection measures we are currently taking, and most importantly, we will explain the critical need for tests related to infection conditions of COVID-19. To better understand the contagion process, we will first examine a model used in 2007 by a group of Italian scientists, used to illustrate the spread of the avian influenza virus, aka H5N1. Luckily, we can also use this model with the same objectives in the case of the spread of COVID-19. As we see in the image, the model includes various entry variables which show the causes of this viral infection. Later on, we will go through the requirements to obtain the information needed to define these variables. Firstly, we could consider the existence of a healthy individual who at a point in time encounters an infected individual. The latter, who could either be asymptomatic and not show the symptoms of the disease, or a symptomatic individual who features indications of the disease. Contact with the infected individual will cause the healthy individual to move on to a state of potential contagion. The state of potential contagion will depend on either the subject's immunological status, his propensity to viral infection, the odds that the individual he came into contact with was actually infected, and the probability of infection through that specific form of contact. If the originally healthy individual becomes infected with the COVID-19 and is not aware of it, he will move on to a latency period during which the virus will incubate. Although, at the moment, experts have not agreed on the duration of this latency period. Recent statistics indicate that it can last between 2 to 14 days, with an average of 3 to 5 days. Afterwards, this individual will begin to suffer from the disease either symptomatically or asymptomatically, which will cause him to become a new transmission agent for the disease, turning the originally healthy individual into a new member of the group of the coronavirus's transmission agents. In the case of the symptomatic patient, the person in question might require immediate medical attention or even hospitalization, depending of course on the severity of his condition. While on the other hand, the asymptomatic individual might be able to recover without the need of medical aid, but his condition might also evolve to a symptomatic state as well, causing him to then require medical attention. The symptomatic individual does have a chance to recover, but it depends on a series of factors that will be mentioned further on. In any case, the recovered patient will be able to resume his activities and get back into society, assuming he is no longer a transmission agent. An important point we should take into account is that if any of these links to infection break, it can substantially reduce the risk of contagion. From this, we can start to take the recommended measures, which include social distancing and avoiding gatherings of people, as the risk of contagion grows in relation to the number of infected individuals we might come into contact with. Avoiding direct physical contact with people, including those in our immediate circle, like parents, spouses, or sons and daughters. Avoiding contact with anyone as long as there is a chance of contagion, at least until we can confirm otherwise, which in of itself shows us the importance of infection tests. Other measures that will enable us to break these links to infection include the use of medical masks, gloves, and other protective equipment. Avoiding going to hospitals and medical care facilities except in case of emergencies, as such places could be a harbor of potential carriers. Moving along, let us delve into the highly probable series of events that affected the contagion, using the 8M demonstration in Madrid, Spain as an example. A few days before the 8M event of the 8th of March of 2020, it is believed that there were already reports that the COVID-19 had already infected the population. These reports included deaths caused by the virus both in the capital and in the rest of the nation. The Spanish population was called to take to the streets, gathering in different parts of the country in the tens of thousands as part of a protest. This implied that there was a high risk of infection due to the existence of local carriers of the disease. The probability of infection is particularly high in large populated cities, as it could spread easily through transit systems, social areas, parks, and town squares. During this event, hundreds of thousands of people congregated in these areas, on their way to the event, as they protested, and as they went back home. Since that moment, people who were infected became immediate or future transmitters of the disease. From these events and protests, the infected individuals who returned to their homes, workplaces, or other social meetings were already unknowingly prepared to transmit the disease through physical contact, as we now know that the virus can survive on various surfaces for prolonged periods of time. At the same time, those who were infected entered the latency period, later developing the disease either in its asymptomatic or symptomatic form. We still have many doubts about this latency period, as we still cannot estimate the amount of time in which the infected are highly contagious. This increments the contagion risk considerably by coming into contact with other people at home, work, or other social areas. As we understand it, the 8M protest was the sort of event where a large and unforeseen multitude of people group up, turning it into a ground zero for a potential pandemic. Other events like this included sports matches, social gatherings, family reunions, and flight travel, among others. But all these still took place even with the existing reports of infected in Madrid and in Spain in general. Unfortunately, these types of actions happened and are still going on in other cities and countries around the world. Once we understand the model of the spread of the virus, we can conclude that to avoid the spread of the pandemic, we must break the links to infection. A measure that should have been taken prior to the 8M protest was to cancel or ban any social and public event. Another way to break the links that we don't have access to at the moment will be the implementation of a vaccine to the public when all these measures can be lifted. The question we now need an answer to is how can we manage the situation we are living in, while also considering the future in both the short term and the long term. We can find a lot of recorded numbers and statistics in the internet, and especially in social media, about the impact of COVID-19. These statistics include the number of infected, new cases, the density of infected people, deaths, and the number of active cases. Acquiring these numbers is only possible through testing, and more testing. We will now discuss the importance of keeping this level of testing beyond these numbers. In general, testing is critical to understand and manage social distancing and the everyday activities people go through. It is a fact that most of the well-known statistics collect global data, but because of it, we are assuming that the impact of the disease is the same around the world, without taking into account the local factors and conditions of the community, town, city, or even the country. To demonstrate the strength and importance of these statistics, let us assume that the ones reported in the Worldmeters website apply to all of Spain. Based on these statistics, we can infer that the part of the population with the highest risk of infection includes people with over 50 years of age, who according to recent data could reach a death toll over the millions. Nonetheless, an important point to consider is whether or not these statistics are applicable to Spain or any other country for that matter, without any sort of confirmation. We have to ask, what people are most at risk and what can we do about the measures we must take to lower those risks? This enforces the fact that we can only generate more reliable statistics and data through these tests. Furthermore, we arrive to our second most important conclusion, which is that the only way in which we can manage the contagion is by performing mass control tests on the entire population. Here, we see another example of the conclusion we can reach through the statistics obtained from tests. In this case, referring to contagion on a basis of gender, people with pre-existing medical conditions, who are one of the groups most endangered by this disease, including diabetics, cancer patients, or people with chronic breathing diseases and hypertension. But in these cases, there are still a lot of questions left unexplained, like why are there so many differences and discrepancies? And what level of certainty can be determined from these differences? One way to solve these unknowns is to do controlled testing. The results obtained can become even more reliable if it takes into account additional recorded information and the consequences the disease might produce, including death. Regarding testing, there are several active websites and social media outlets that attempt to explain the different kinds of tests being done, their specific applications, and information that each one provides. Of course, a more specialized test can be done depending on the data that the person requires. If you would like more information, we invite you to visit the official websites. We have concluded that the only way to obtain the information we need to understand the pathology of the COVID-19 is through massive testing, showing us once again the importance of doing them. An especially important example to consider is the preventive and medical management that we have had to go through in this first wave of the virus. Through testing, we could describe how the COVID-19 interacts with our immune system and its consequences based on age, gender, racial background, social status, etc. This will allow us to be ready and reduce the spread and impact of the disease, and notably decrease the number of deaths as well. This management will also include careful planning when it comes to hospitals and specialized areas, the number of available beds, ICUs, and medical personnel, as well as professional development, the continuing of education for the population, and the setup and use of emergency protocols. At some point, and the sooner the better, we will start seeing that countries and governments will try to normalize society in some form to minimize the economic impact of COVID-19. What should we consider when trying to open the economy after social distancing? It all goes back to knowing the impact of the virus and its consequences, underlining once again the importance of testing. As we have seen before, the answer lies within the data obtained through the tests. Models and statistics applied after confirmation through testing when it came to Spain gives us an indication that given all the uncertainties that we still have, we must take action and all the necessary precautions to avoid returning to a state of high risk of contagion and the associated economic crisis that this entails. Based on testing, the results could give us an indication of when we can go back to some form of normalcy. In other words, this will help us work out how to restart the economy. Which companies and businesses should be reactivated first? Which workers should go back to their jobs, and how should they do it? How can we use modern technology as well as prevention and relief protocols and measures to slow, contain, or eliminate the spread of the virus at the workplace? What are the day-to-day medical measures that should be taken by workers, as well as what to do and where to go if someone presents symptoms of a new wave of contagion? Finally, we can conclude with the following. First and foremost, we must take all the necessary precautions to break the infection links previously described to drastically reduce the spread of the virus. Secondly, given how important massive testing is, we must ensure that it becomes an important factor when it comes to social and economic policies when affected by the COVID-19. As stated before, more widespread tests are necessary as soon as possible to provide all the answers we need to make informed and better decisions. Thank you all for your attention, and until next time, stay safe and stay healthy.